Good afternoon, and welcome to World in 5, your trusted source for comprehensive coverage of today's most pressing events.
It has been nearly a week since gunfire erupted at a rally for Republican presidential candidate Donald Trump in Butler, Pennsylvania. The incident resulted in Trump being injured, the death of one attendee, Corey Compertor, and severe injuries to two others. We have Shelby reporting on this.
Despite images showing Trump appearing only slightly injured and in high spirits since the attempted assassination, the campaign has provided minimal information about his condition, the care he received, or how his medical team will monitor his health in the coming days and weeks. A comprehensive public assessment of Trump's injuries is crucial. This transparency is important not only for Trump's own health but also for voters who need clarity about the recovery of a man who could potentially become president again. Gunshot wounds, especially those near the head, can lead to serious complications that might not be immediately visible, such as bleeding in or around the brain, inner ear damage, or psychological trauma. As a trauma neurosurgeon, I have observed that a thorough evaluation following a gunshot wound can provide a complete picture and facilitate a faster recovery. Back to you, John.
Thanks for that update.
With a summer surge of COVID-19 infections sweeping the country, a new study has examined the risk of developing long COVID and how this risk has evolved over time. We have Anthony reporting on this.
The study found that while the likelihood of developing long COVID has decreased since the beginning of the pandemic, it remains significant, particularly for individuals who are not vaccinated against the virus. According to an analysis by the Federal Agency for Healthcare Research and Quality, published in June, about 7% of American adults, or roughly 18 million people, have experienced long COVID. In 2022, Harvard economist David Cutler estimated that the total cost of long COVID to the nation was $3.7 trillion, equivalent to 17% of the country's pre-COVID gross domestic product. Published Wednesday in the New England Journal of Medicine, the new study indicates that both the human and financial toll of long COVID may continue to rise. Researchers at Washington University in St. Louis and the VA health system utilized advanced machine learning and data from millions of medical records maintained by the Department of Veterans Affairs. They aim to assess the risk of long COVID symptoms at different stages of the pandemic, before vaccines were available, during the dominance of the Delta variant, and after the emergence of the Omicron variants. The study also examined the impact of vaccination status, categorizing individuals as vaccinated if they had received at least their initial series of shots, and as unvaccinated if they had not. Back to you, Bella.
Thanks for that update.
Michael Roman said, "I'm writing from Spannacchia, an organic farm and ecotourism site in Tuscany, where I just enjoyed a couple of mullet eggs, whites cooked, yolks runny. They were delicious, but I'm concerned about the current bird flu situation and whether it should affect how I prepare my food." We have Jensen reporting on this.
Recent reports have highlighted the spread of bird flu among wild birds and marine animals, and its transmission to mammals like cats, dogs, and even mice. This raises questions about whether the temperature at which I cook my eggs should be adjusted and what advice I should give to home cooks regarding this issue. The avian flu, particularly the H5N1 strain, is spreading rapidly through dairy farms across the United States, affecting over 90 herds in 12 states since March. This has heightened the risk associated with consuming raw or unpasteurized milk. As Donald G. McNeil Jr., a seasoned journalist on epidemics, noted, our national dairy industry is clearly fighting a major epidemic of H5N1 avian flu. While I've enjoyed raw milk in the past and found it delicious, it's important to differentiate between bacteria and viruses. Viruses can mutate and spread in ways that bacteria do not. Given the current situation, it's advisable to avoid raw milk to protect yourself and prevent the further spread of the virus. As for eggs, cooking them thoroughly to an internal temperature of at least 160 degrees Fahrenheit, 71 degrees Celsius, can help reduce the risk of any potential pathogens. For home cooks, the best practice is to ensure all poultry products, including eggs, are cooked thoroughly to safeguard against any potential health risks. Back to you, John.
Thanks for that update. Thanks for tuning in to World in 5 for your daily dose of news and updates. Don't forget to hit that subscribe button and turn on notifications so you never miss out on breaking stories and insightful analysis.